Although prostate cancer is the second most common cancer among men, it can often be treated successfully. Here with some more facts about the disease is Baptist Cancer Center medical oncologist Dr. Jankov. Welcome.
Thank you, Mark.
Our show today, of course, is about men's health, and one of the biggest concerns that men have, I know when they come into my office for their annual physical, is what about my prostate, and what about my risk for prostate cancer, and are you going to do a PSA on me? Get that question almost every day. So how do you normally diagnose prostate cancer?
Well, it is a very valid concern because when you take a look of the risk of developing prostate cancer in an average American male, it is basically 14%, and the risk of death or dying from prostate cancer is 2.6% for American male population. It is rare in 30s, and before age 40, you really don't have to worry about it unless you have a strong family risk. Now, it is diagnosed by biopsy. However, and usually the first step is obtaining the PSA. That has been associated with a great deal of controversies over the past 20 years, and I'm sure you had experienced many questions that followed after obtaining the PSA. So doctors would usually get a PSA, which, if abnormal for your age group, may trigger the further workup, including the biopsy, which then leads to diagnosis of prostate cancer.
Yeah, we were just talking to the urologist about testosterone replacement. Is there a correlation with elevated testosterone levels and prostate cancer?
No clear correlation. It has not been shown to cause the prostate cancer. However, in latent forms of prostate cancer, unrecognized at the time of testosterone initiation, it certainly can fuel the growth of already existing prostate cancer.
Now, once the diagnosis of prostate cancer has been made, what's our options on our treatment tree?
That is the most interesting and challenging part of the treatment decision. And of course, you can pursue the radical prostatectomy or radiation, brachytherapy. And there's the third option called active surveillance. And that is very appropriate in prostate cancers that are low grade. In high-grade prostate cancers, you do want to pursue the immediate therapy with one of those three measures that I mentioned. However, the process that patients should go through is that they should talk to both a urologist, radiation oncologist, and also I would favor that they talk to medical oncologists, because they need to discuss all the options available, because both radical prostatectomy, radiation and brachytherapy do render just around the same percentage of cure, but the side effects are different, and they may be appropriate or not appropriate to a different population of patients.
Now, I get this question asked often. Doctor, is there anything that I can possibly do to prevent prostate cancer?
Yes, you can prevent prostate cancer, but it's rather hard work. And it's actually based on having a proper amount of exercise, pursuing the healthy diet, having a BMI or a body mass index that is within normal limits. None of the pills, none of the supplements, none of the quick fixes actually panned out. And as a matter of fact, they were outright dangerous and actually caused more prostate cancer rather than help.
So if anyone is contemplating taking any type of supplements, be sure, please check with your doctor before you do. Now, in our last minute or so, is there anything new on the horizon in the treatment of prostate cancer?
Well, the new things would be finding the genetic test that can actually answer the question why 42% of prostate cancers appear to be hereditary, but we could not identify the specific gene. And it appears there are no specific genes, but rather a cluster of genes that in certain people can actually be indication that they're going to be at higher risk for prostate cancer. So that will be certainly one big step forward.
Now, you still recommend that a man get a PSA every year or not?
Not everyone. if you take a look at the ASCO guidelines and NCCN guidelines, men who had relatives, or actually first-degree relatives like brothers and fathers diagnosed with prostate cancer, and also if they have a known mutation, that they harbor known mutations such as BRCA2 or BRCA1, that they should start testing themselves at age 50 and or at early 40s, depending on which recommendations you take a look. For the rest of the men, for general population, without having a definitive test that could identify your risk to be excessive, it is very interesting question that you may run the risk of obtaining the PSA and then diagnosing a patient with a low-grade prostate cancer that does not have to be treated outright.
Well, thank you so much for being here today. Very important information about prostate cancer, and please listen to what the doctor had to say. Next on Health Matters, exercise is an important part of staying healthy, but some of these exercises can be unhealthy for you. Stay tuned and find out what.